So if you're only missing one tooth, why a dental implant over a traditional bridge?
Well, traditionally, bridges have been great. Basically, history tells us they last 10 or 15, maybe 20 years. But the problem with a bridge is that eventually it can lead to other problems. You can get a cavity around them. You can possibly have to have a root canal, and then you lose your whole bridge. Where if you get a dental implant, as periodontists, we know that just replaces the tooth. It lasts longer. The success rate of a dental implant over 22 years is 92%. The success rate of a bridge over 15 years is only 50%.
Okay.
So why not get a dental implant, just replace the tooth? You never have to worry about it getting a cavity or needing a root canal.
So if somebody in your family and they were healthy and they were of the age where you could get a dental implant and they were missing just one tooth, would you every single time get an implant?
Absolutely, every single time.
Like you'd never do a bridge on a family member that was an adult?
The implant is the gold standard. You want to get the implant every time. Why not replace the tooth? Why involve the teeth right next to it when you can just replace that single tooth? And it's going to look just like the tooth that you're missing. Nothing ever changes.
And it's about the same cost as a bridge, but one lasts longer, and definitely in the long run, it's cheaper.
Exactly. Yeah. Up
front. So why don't they all do it? Just they hear the word surgery or they hear the word implant. What is it?
Well, maybe there's some fear. Maybe there's just some misunderstanding still. But they just need to come in and see the options and let us explain it to them on how it's done.
What about pain? It seems painful to do it.
It's not uncommon for me to have my patients come back and say they had no pain at all. They didn't even take the prescription of medicines that we gave them in case they had pain.
Okay.
So that was totally useless because they didn't even need it.
Could they go back to work like that day, the next day?
Well, at first they're concerned. They're like, Doc, do I need to take a week off for this? Do I need to take a month off for this? And most come back and say, I went back to work the second day.
Okay. Now, obviously you're doing a lot of sedation on these patients, but if they actually had no sedation, they could go back to work that day.
They could go back to work same day. Yep, absolutely. Here's the thing about sedation. The sedation is if you're feeling a little bit scared. If you have a little anxiety, if you've had a bad experience, do the sedation. Do what you need so the experience goes really easy. But as far as pain afterwards, you tell me after you come in and have it done. You'll be surprised. Most patients say no pain whatsoever. Now, obviously, everybody's tolerances are different. But I would say most of the time, nothing. Just take a Tylenol.